Sir.
Thank you. I was part of the Hindi session, especially to Dr. Sahani sir, who is the captain of this Hindi session. Good morning, good afternoon, and good evening. Welcome to the 1490th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer. Thank you and welcome back. Today we have with us Dr. K.A.SHALINI, graduation from Homeopathic Medical College, Bangalore, certificate course in Children Health, CGH, certificate course in Gynecology and Obstetrics, CGO, certificate course in Skin and Venereal Disease. And the topic is diabetes mellitus and its homeopathic treatment. We know a lot of cases, it is often questioned as lifestyle diseases is rising, and Kerala is the capital of diabetes in India, I think so. Anyway, on behalf of IFPH, and welcome Dr. Salini, you can have a platform for next 45 minutes. It's over to you. Please proceed.
So thank you so much. Thank you so much for giving me an opportunity to present regarding the topic diabetes mellitus and its homeopathic treatment. I'll be sharing the slides. Okay. So today we are going to discuss about diabetes mellitus. As we all know that it's become a common diabetic patients we can see more common in our clinical practice. So in our day-to-day clinical practice, we see out of 10, 8 patients will be of diabetes only. So it is actually the time was there when diabetes patients we used to see above 45 years or 50 years or 55 years above. But now the time has changed, or based on our lifestyle, sedentary lifestyle, and irregular food habits, no exercise. Based on this lifestyle, ill habits, we can see diabetes mellitus insulin dependent or non-insulin dependent in a very young age. We are seeing cases. So this has become a more common problem. Any patient sugar checkup is only done. So
Dr.
this has become more common.
Just a moment, interrupt you. Can you make this slide more wider? It is very. Some people is asking about. Little bit higher. Now it is. I think it is okay, but only half the portion of the slide is visible.
She is doing the mobile phone. That's the problem, sir.
Oh.
Yes.
Okay. Anyway, you can do as you. But by increasing the size, you are out of range. You are becoming.
Yeah, I will move the slides, sir. When I'm speaking, I'll move.
Okay, no problem. You continue.
Right. So in our day-to-day practice, diabetes mellitus has become more common in patients, and in our clinical practice, we see at least 10 patients. For example, out of 10, 8 to 9 cases will be of diabetes. If we see any skin-related problems, for example, psoriasis, or any skin-related who have unknown diabetes, means they would have not got checked for diabetes, and the skin problem would have not been healed early or cured or relieved early. So everyone will go for random blood sugar checkup. So first today we'll know what is diabetes mellitus. The definition of DM. Diabetes mellitus is a clinical syndrome which is characterized by increased blood glucose level, that is hyperglycemia, due to absolute or relative deficiency of insulin or both. So here we can see defects in insulin secretion and insulin action, a defect is seen, or both. So diabetes mellitus in simple way we can understand is increased blood glucose level in the blood. Increased glucose level in the blood. Here you can see the picture. It's very easy where you can see the first picture. You can see stomach. Inside the stomach, the food is converted into glucose. You all know metabolism takes place and the food is converted into glucose. The second is glucose enters into the bloodstream. So when the glucose is released from the stomach, it goes to the bloodstream. Here in the third picture, you can see the pancreas produces sufficient insulin, but it is resistant to effective use. Means the pancreas will produce the insulin, but it has become resistant to the glucose. So that is the third point. And in the fourth point, glucose is unable to enter body effectively. So here, when the pancreas produces sufficient insulin, but it becomes resistant. So the glucose is unable to enter the body effectively. So gradually it leads to glucose level increases. You can see in the picture. So this is the easiest way to understand. Hope you all understood. You can see the stomach and pancreas in the picture. When we eat the food goes into the stomach and metabolism takes place, and the food is again converted into glucose. Glucose enters into the bloodstream. So the pancreas produces sufficient amount of insulin, but it is resistant to the glucose. So obviously the glucose is unable to enter body effectively. So the glucose level increases in the blood. So the patient gets diabetes mellitus. This is the simple way of understanding diabetes mellitus. So when the glucose level increases in the bloodstream, diabetes we can see in males and females also. Okay, there is no gender biased. And nowadays, so you can see juvenile diabetes, which is seen in younger children, also 16 years, 15 years, taking insulin slots daily. So when diabetes is there in any patient, what are the signs and symptoms we can see? Means the first one is nausea. These are the general symptoms. Nausea, feeling hungry, like the appetite is increased, and there is numbness in hands or feet, and there is constant thirst, increased thirst, and the patient feels very tired, weakness is present, and the sudden unplanned weight loss will be there, irritation and mood swings, frequent urination, blurry vision. So these are the signs and symptoms. I'll share my clinical practice. One female had come to me with the symptom of sudden weight loss, and she was feeling very tired, and mood swings were there, and she didn't undergo any diabetic profile test or any hypertension test and all. When she came to me, I just advised her to take a diabetic profile test, that is fasting blood sugar and after food blood test and random blood sugar, and her readings were 275. That is the diabetes was more, and there was sudden weight loss was there. And we started with the treatment based on the individualization, based on the homeopathic way of treatment we started. So these are the signs, these are the symptoms where we can find in any patient. So what are the types of diabetes? The first one is type 1 diabetes, which is caused due to deficiency of insulin, genetic variations, and autoimmune response or leading cause. So type 1 diabetes is seen in children also. It is caused due to deficiency of insulin, genetic variations, and autoimmune response or leading cause. Second one is type 2 diabetes. It affects adults, caused due to insulin resistance by body, which I am discussing now. Obesity is seen in some patients due to inactive lifestyle, hereditary or leading cause. Gestational diabetes occurs during pregnancy, excessive weight gain, genetic history of diabetes. MODY, very rare, caused in adults below 25 years of age, caused due to genetic variation. So these are the types of diabetes. Okay. Diabetes mellitus, you can see in the picture. In healthy patient, pancreas insulin receptor will work normally. In type 1 diabetes, pancreas fail to produce insulin. In type 2 diabetes, cells fail to respond to circulating insulin. So easily you can remember, type 1 is pancreas fails to produce insulin. Insulin deficiency, diabetes mellitus. In type 2, cells fail to respond to circulating. Means in the blood, the insulin will be there, but the cells fail to respond to it. So that is type 2 diabetes. Now we'll see the comparison of type 1 and type 2 diabetes. Feature, type 1 and type 2. Onset in type 1 is sudden. In type 2, it is gradual. Age at onset, type 1 diabetes is mostly seen in children. Type 2 diabetes mostly seen in adults. Body size is thin or normal in type 1. In type 2, it is often obese. We can see the term called ketoacidosis, which is common in type 1, and type 2, it is rare. Autoantibodies usually present in type 1 diabetes. In type 2 diabetes, it is rare. Sorry, it is absent. Endogenous insulin in type 1 diabetes, it is low or absent. In type 2 diabetes, it is normal, decreased or increased. And you can see concordance in identical twins. In type 1, it is 50%, and type 2 it is 90%. And the prevalence rate is around 10% in type 1 diabetes, and in type 2 diabetes it is around 90%. So when a patient has diabetes mellitus, what are the complications happens to him? So when we take it to macrovascular, the first complication is stroke. He may get stroke. Heart disease and hypertension, increased blood pressure we can see, and peripheral vascular diseases are seen, and food problems. So this is the one most common symptom we see in our clinical practices. There is numbness in the food. The patient comes to us and he says that there is numbness in the food. The tingling sensation is there in the food. So first we need to advise him to go for diabetic profile test. Then we can further we can give the treatment to him. And in microvascular, diabetic retinopathy and cataract, we can see as a complication. Renal diseases, neuropathy, and food problem is seen in microvascular and macrovascular. So these are the diabetic complications. So now we'll see what are the risk factors of diabetes. Diabetes can affect anyone. Knowing the risk factors can help identify the changes to make to your lifestyle. So how we can prevent, or how the risk factors are seen means, have a family history of diabetes. Like any patient who has a history of diabetes, then that person can get the diabetics very easily. And have a history of gestational diabetes. When a female is when she was pregnant, when she had got diabetes, so she has a history to get diabetes. So have a history of gestational diabetes. Have above abnormal blood cholesterol lipid levels. So routinely we need to advise every patient to go for lipid profile test, diabetic profile test, so that if any lipid profile in the cholesterol level is abnormal, then that patient can get diabetes easily. Have impaired glucose tolerance or impaired fasting glucose. Means when the patient has impaired glucose tolerance, then he may get diabetes very easily. When the patient is hypertensive, means when he has high blood pressure, then he is at the risk of getting diabetes. Any patient which are above 40 years old, we need to screen for diabetes. Lead an inactive lifestyle. And the patient has sedentary lifestyle, means like for example, I have seen in my practice, like there are some patients like they don't even walk for some 2 minutes. For any shops or any malls, they go by car and they will use lift when they are working at a company or any office. So, like inactive lifestyle, there is no exercise to the body. It may lead to diabetes. And who has body mass index higher than the normal range, that is 23, or at the risk of getting diabetes. So, what are the simple steps for prevention of diabetes? Healthy lifestyle should be there. We need to give awareness about diabetes to the patient who comes to us. We need to explain to them what are the complications of diabetes, what are the signs and symptoms, because many patients will be not knowing. Like, for example, if they have increased thirst or increased urination, they just ignore it. But we need to give awareness to the public, like what is diabetes mellitus, what are the signs and symptoms, and what are the complications, and what are the prevention method um, they can do in their life. So we have to explain to them to maintain weight properly. If they suddenly lose weight, they have to come to a doctor and get diabetes test or lipid profile test, or any health checkup has to be taken. And they have to maintain a healthy diet. They should not go on western lifestyle of food. They have to take food properly, homemade, fresh. The food has to include vegetables, fruits, has to be included. They should not go food for maida or any Western lifestyle, and all should be avoided. We need to give our awareness to them, and we should advise them to go for exercise. Do exercise daily for 30 minutes, 20 to 30 minutes. They have to do exercise by walking or jogging, or any kind of exercise has to be done. And we should make them to avoid sedentary lifestyle. We should give awareness so that they walk for at least 15 to 20 minutes in a day, so that a healthy lifestyle is maintained. And they have to maintain vitamin D. That is more common. We see vitamin D deficiency patient nowadays because they are not exposed to sunlight. They will be inside the house, or they'll be inside the company or office. Due to deficiency of vitamin D also, the patient are at risk to get diabetes. And we should advise them to avoid smoking and alcohol, because those things will are at a very risk for any patient to get diabetes. So now I'm going to discuss about the case presentation in homeopathy, which I have got in my clinic. The patient came to our clinic. He was tried to be treated by various physicians and referred back and forth. The patient came to us, and he was dog bitten 2 months ago. The disease progressed as follows. What were his presenting complaints? The trouble was noted 2 weeks ago. In the beginning, the speech begins to slur. Many words he used to speak used to be unintelligible. Irritability increased to a marked degree, became violent, angry, and dangerous. Mild fever off and on was there. Symptoms in this regard changeable. Extreme thirst was seen, ravenous hunger, hurried and impatient. Desire to escape, desire to bite and strike on others. Balance of the body became unstable, salivation copious visit, great stiffness in lower limbs, no pain. Okay. So the patient had increased thirst was there, and sudden weight loss was seen, and he was dog bitten, and he was diabetic, and he had taken the vaccination for dog bite, but he was diabetic also. When random blood sugar test was done, the readings were around 350. So he was insulin dependent, and he was taking insulin shots also. Then we took the case properly, and based on the individualization and based on the characteristic symptoms. Based on this, he was based on the repertorization also. Um, what were the remedies came to us was phosphoric acid was there, arsenic album was there, naxomica was there, and he was the patient who had dog bitten also. Mm, so Rabipur vaccination was also given, and based on this, his lifestyle, we made him to change. We made him to do exercises daily. We made him to do yogasana so that his mind becomes calm. The food lifestyle was changed in him. Um, so we made him to take vegetables, fruits properly, and he was very alcoholic, and he was a smoker. So we made him to stop by making him to get into a rehabilitation center, and based on the symptoms, of phosphoric acid was prescribed to him. Based on his lifestyle changes we made him, and based on the treatment of homeopathy, suddenly like the improvement we can see in him. Based on the rehabilitation center, there they used to do yoga, meditation, and they made him to work there only, and he was alcoholic also. So based on this symptoms, phosphoric acid was given to him, and slowly within 4 months, like symptoms of that anger, irritability, and all came down. It was due to alcoholic also. Then gradually the symptoms were reduced, and now he is doing like he's doing properly. So the homeopathic medicine, phosphoric acid, worked for him. Um, like when the case we were taking, we were thinking of arsenica album also. And in the middle, when he was alcoholic, also naxomica medicine in 200 potency was also given to him, which also helped him as he was a chronic alcoholic, and he had that anger on small things, that and all came down. Phosphoric acid helped him a lot. um, Starting he went to allopathic treatment. There he was taking insulin slots daily, but there was no improvement, so he was going um, to many doctors, and the treatment was not so then he came to us. Sorry. I'm so sorry. Okay, I'm so sorry of the slides has been misplaced. Okay, the other medicines where we can see for the diabetes mellitus is, as I have already told, naxomica in chronic alcohol, that works very well, and in arsenic album, where we can see like the patient looks thin and tall, and he'll be having frequent of cold and coryza, and random blood sugar will be increased in him, and he will be kind of very alone, kind of like in arsenic album. He wants everything to be clean and tidy, and he wants everything to be in a place. So that is arsenic album I have seen in the patient. Um with the diabetes, arsenic album has worked very well, and I have treated other patients with diabetes. The other medicine was naxomica, because he was diabetic and he had taken lots of allopathic medicines of insulin, medicine, tablets, and all, but there was no improvement on him. So when that patient, aged around 45 years, came to us with more doses of allopathic medicine, So when he came to us, first we prescribed him Naxomica. So that Naxomica calms down all the heavy doses of allopathy. So Naxomica was given for 4 days, and the dosage was morning and night, that is BD, for 4 days, and slowly the symptoms of heavy dosage of allopathy came down. Then the case was taken, and when the case was taken, Naxomica only was like on based on repertorization, Naxomica was given to him, so that cured him. So in my practice, in recent, phosphoric acid, Naxomica has treated the patient very well. So based on this, I have been getting many cases with hypertension also. So one lady had come to me. She had a symptom of headache, which is of migraine kind, from 6 years. She was just taking medicine of some in the medical shop. She was taking for time being. She used to get normal, and she was ignoring it. She was thinking it is due to gastric problem. When she came to me, like when I took her to confidence, and slowly she revealed that she'll be getting headache frequently. When I checked her BP, she didn't go to any doctor. When I checked her BP was 160/90. So first when I checked, then I made her to come daily for the BP checkup. So when she came daily, on the third day also the readings were same. So on the first day, 160/80 was there. So then I advised her to go for diabetic profile test also. So on the second day, diabetic profile test, her random blood sugar was around 180. On the third day also, her BP was same reading was there, 160, 155, the same. So she was suffering from hypertensive and diabetes. Her common symptom was headache, and there was numbness in the foot. So these were the presenting complaints. So when the case was taken, it fitted into natramure patient, because her headache, she used to get aggravated in the morning. The timing is between 10 to 11 a.m. Her headache was increased. When she goes into sunlight, her headache is to get more. She wanted to be alone. She used to cry for small things, and she was lean and thin, and she was around 35 years age, and her skin was oily. She used to get acne on and off. Um, these were the symptoms. So when the proper case taking was there, and she used to like salt more, salted food. She used to like more. So her mental symptoms were she was worried of the family and the office work, what she was doing. Headache was there. She was irritable, and she used to get angry very soon. So based on the repertorization, natramure fitted her. Natramure 200 potency was given to her. It was given for BD for 4 days. And we advised her to drink water and to eat food properly and have daily exercises. And this treatment was started. And later on, her headache gradually it decreased, and that irritability that and all came down. And the next month, when we made her to go for diabetic profile test and BP came to normal, like 125/80, and her that salt craving also came down. Her diabetic also, it came to 120, 110 to 120 it came. So we advised her to go for lifestyle modulation also. Like her food has to include vegetables, fruits, and exercise, and she has to drink water and meditation. We advise. So based on these things, within 2 months to 3 months, her symptoms came down and she came to us and she told that she is feeling better. So that is the biggest reward which we as a clinical practitioners can get. So so these are the cases which I have seen in my practice. So thank you so much.
Yes, time for discussion. Those who would like to participate, please raise your hand. You can add, you can ask some doubts or some suggestions. I think Dr. Gurugaran is there. Dr. Gurugaran, what is your opinion? Dr. Gurugaran, are you there? Please unmute and come forward. Yes, welcome.
Yes, sir.
Yeah.
Sir, I have seen the cases. I want to ask a question that all the two cases what she has showed has been reversed or it is under control.
Yes.
It's under control. It's not reversed. It is under control.
Okay. So can you reverse it after giving this constitution medicines?
As I have given based on the repetization, it is under control. But the reverse, yeah, it depends on the patient. It may be reversed, but in my practice, it is controlled.
Okay. Okay. According to my experience, it can be reversed.
Very good.
Okay.
Yes,
Okay.
please.
Then you can go ahead with those constitution medicines. So that if there is any blockage or if there is any paucity in the case, in the progress of the disease, you can make use of sarcodes and nosodes in the case,
Okay.
so that it will be helpful for the patient. Once it has been done, it can be reversed. After that, you have to check the HbA1c levels.
Yeah.
HbA1c has to reduce to 5.5 or 5 point below 6 pack, so that it can be shown to the world that case has been reversed.
Okay.
I have withdrawn a lot of cases. Lot of cases withdrawn the medicines. Till now, 2 years it has, 1 year, 1.5 year, 4 years, lot of cases without any medicines. HbA1c is still in normal level. So it shows that the case has been reversed. So this is the potential of homeopathy, right? Homeopathy practice.
Yes.
That I want to say. You can please continue those treatment.
Okay. Thank you so much.
Okay, fine.
Definitely, you have got the potential to treat such cases. Gurugaran, congratulations. What about the percentage of cure in diabetes case, Dr. Gurugaran, in your opinion?
Sir, it is there, sir. Again, being a lifestyle disorder.
Yeah.
The lifestyle has to be changed if there is any problems in their lifestyle, in the patient's lifestyle. It plays a very important role. Apart from that, our medicines has to work properly and has to be given properly. After that, by the way, in the treatment, we have to advise the patients to change their lifestyle if there is any problem in that. Then we can say it is like that. But actually, the curative word what we use in diabetes, it's a controversial thing. What I mean to say, because it is better to use reverse. If somebody hears this, they'll ask the perfect data that what is the meaning of curative and how diabetes can be cured. Because as we all know that in the conventional medicine, it can be cured. So the right word, the apt word is reversible. Because why I can say reversible is at any point of time in their life, due to their lifestyle changes, it may appear back. So that exactly we can't say it is cured due to their lifestyle problems. Because we can't expect that every lifestyle should be as perfect as same as what they follow in the way of treatment. It may change. It may change. The lifestyles may change for them. So all those things considers, so that better to say it is reversed.
How much relevant is this lifestyle disease, in your opinion, of Gurugaran?
It's a lifestyle disorder. So diabetes itself is a lifestyle disorder, no doubt.
if there are a lot of persons who is not at all caring about these things and they are still non-diabetic, no problems are affected. At that juncture, we must consider the role of miasms.
Yeah.
If it is there, that will be affected, and is non-miasm, definitely will not be affected. The person
Yes.
206 could not say so.
Yes, sir.
Too insignificant to cause a chronic disease to continue year by year and develop is the advice given by our master. So I think
Yes,
up to a
yes.
certain extent we must depend on all these things. Otherwise, the miasm is a major part there.
Yes, yes.
If anybody
That's
is
where again the nosodes and sarcodes helps better
yes,
as an anti-miasmatic.
yes, that's good.
Yeah.
Definitely. That is the importance or relevance of this miasmatic theory.
Yes, sir.
Yes.
Because we have to, that is our, what we say, that is our core of our system. We can't forget the miasms at all.
Yes.
If anybody asks any obstacle to cure, then we have to think of that, the miasmatic approach.
Yes, definitely. Just like the string of the this garland, it connects each and every bead or a flower, but we can't
Yeah.
see from outside. But there
Yes.
must be a string, just like that.
Yes, yes.
In Bhagavad Gita, it says the Sutra Manigana Eva. He just connecting everything. That is the role of miasm, I think. If anybody there would like to participate, please raise your hand. You can ask some questions or you can add something as Dr. Guru done. Because these are young talented physicians. They are the scope and hope of homeopathy in the coming years, definitely. Then you said about this type 2 diabetes and type 1 diabetes. What is the modality for diagnosing this type 1 or type 2 diabetes?
Yeah.
Yeah.
As I have already told in like any patient who comes to us above 40 years, we need to screen for diabetes. We need to ask him to go for diabetic profile test. That is fasting blood sugar, PPBS, that is after food 30 minutes, they have to go for blood test and random blood sugar. So this has to be, this diabetic profile test has to be done for every 3 months so that his the blood glucose level in the body is screened or seen. So based on these things only, on the diabetic profile test, we can find out whether he is diabetic or he is in the borderline or if he is pre-diabetes. That we can see by the by this diabetic profile test only.
Okay, there's a question. How can you differentiate type 1 and type 2 diabetes on the basis of symptoms?
I have shared you. I'll show once again.
Yes, please.
Yeah, I'll show once. See, in how to differentiate between type 1 and type 2 diabetes. In type 1 diabetes, it affects children and it is caused due to deficiency of insulin, and it is due to genetic variation and autoimmune response or the leading cause. In type 2 diabetes, it affects adults. It is caused due to insulin resistance by the body, obesity, inactive lifestyle, hereditary or leading cause. So in diabetic, the causative factors are genetic variation and autoimmune response. In type 2, obesity, inactive lifestyle, hereditary or the causes. In type 1, due to deficiency of insulin. In the type 1, due to deficiency of insulin. In type 2, it is due to insulin resistance by the body. Here I have already shown how to compare between type 1 and type 2 diabetes. In type 1, it is of sudden onset. In type 2, it is gradually, slowly it is developed. Symptoms are developed. In type 1, mostly in children are seen, and in type 2, mostly in adults. And the physical features in type 1 is the patient is thin or normal. In type 2 in type 2, it is obese. And in type 1, the most common we can see the symptom of ketoacidosis. In type 2, it is not seen. In type 1, autoantibodies are usually present. In type 2, it is not present. Endogenous insulin in type 1 is low or absent. In type 2, it is normal, decreased or increased. Okay, these are the comparison points of type 1 and type 2 diabetes.
Okay, it is now crystal clear, I think. Yes.
Yeah.
Any more questions?
See in this image, you can see in normal, you can see healthy normal, the pancreas is normal, glucose, insulin receptor as in this picture. You can see in type 1, the pancreas failed to produce insulin. In type 1, pancreas, it fails to produce insulin. In type 2, the cells fail to respond to the circulating insulin in the body, in the blood. So this is the differentiating point. So these are like you can differentiate between type 1 and type 2. Yeah.
Okay. Yes.
Sorry. Yeah.
Okay. Now, Dr. Ram Parvesh Shah. Sir, what is your opinion? You can share something. Yes,
Thank
sir.
you, Manoj ji. Hello. Thank you, Manoj ji and Dr. Shalini. Congratulations. Very nice presentation. Diabetes mellitus. Main cause of diabetes. Deficiency of electrical disbalance. Jal pavak gagan samira. Lifestyle. Electrical disbalance. Then endocrine glands disturbance and other symptom, mental symptom, anger suppression, past history, family history, and emotional suppression is called produced diabetes. Type 1 diabetes and familiar father, mother, and type 2 diabetes. They're very important in lifestyle and deficiency of endocrine gland. So, due to, according to law of homeopathic science, suppression of anger, grief, insulty, etc. and lifestyle is a very important. It is treatment, homeopathic, many kinds of medicine, and but exercise is a very important role of the very important exercise. Diabetes maintenance. Diabetes is the maintenance. So very, very thanks, Dr. Shalini. Thank you.
Yes, that's the words from one of the senior physician IFPH. And the coming days, we are about to our 1500 days session seminar, the IFPH, are completing. So from the 3rd October to 9th October, we have a 1 week special programs based upon the application of homeopathy in the veterinary science, agriculture, and the human beings. I think it is time to develop the homeopathy into more and more areas, especially the dentistry is a major area. And the last day we have a session with one of the dental doctor in IFPH, and he explained and he scoped that he said that the recurrence can be prevented. They are not at all able to prevent the recurrence, but homeopathic medicines may be capable of that. That's the most important thing. Then also in case of this agriculture field and veterinary field, about the food safety, everybody is talking about this organic food and food safe food. How it become possible while taking these antibiotics and other things? Only through homeopathic medicines we can do it. So it's really a great boon to the humanity, homeopathy, and IFPH is planning to expose all these to the public domain. So I think everybody should cooperate with that. Dr. Gurugiran, what is your opinion on that?
Yes, sir. Definitely, sir. It has to be done in the public domain. It's a very good idea, so that people will come to know what is the potential of homeopathic treatments in these kind of cases, and it will be a very good educative program for the public. It has to be done. It is the most needed program. Please go ahead, sir, with these kind of conditions, and any kind of any required data I'll be able to give from my part.
Very good. So most encouraging news. And the coming days, one of the organizations in Kerala, Institution of Homeopathy Kerala, they are conducting a program in Trivandrum, and where they have arranged such sessions, and they invited the Honorable Minister of this Agriculture and Animal Husbandry to participate in this session. So that will be more interesting. Definitely, they'll be informed, especially the top officials and the politicians must be informed about that. And also those on this media, they're also is a very key. They can play some pivotal role in promoting this scope of homeopathy in that areas also. And what is more important is that our pharmacists, the pharmacy industry must recognize these endeavors from the homeopathy physicians, and they must ready to support these organizations so that their graph can also be increased and they can develop themselves.
Sir, one more thing, sir. Recently, I was studying a book in Kannada literature, sir. There is a book from a doctor, actually.
Yeah.
They pointed out some of the what we can say loopholes in other systems of medicine.
Yeah.
In that major loophole, what they have pointed out is lack of standardization.
Yes.
This also I want to stress on it, because we have to standardize our homeopathic practice.
Yes.
So that anywhere, any part of in our country or anywhere, when we give the treatment part, the details of the treatment part and the medicines what we have given, whatever it is, it has to be written and it has to be transferred to the other doctor who is continuing the treatment of the patient. So it becomes a standardization where they will come to know that what has given, what has to be given next, what is the constitution of the patient, what is the miasm which he was treating at the time of the patient when he came to the clinic. All those things, it has to be standardized well. I think this part has been lacking in our system of medicine. It has to be taken care of it. Second thing, I have observed that in Delhi, that National Institute of Homeopathy, recently what they have inaugurated just 3-4 years back by our Honorable Prime Minister of India. There, one of my junior is working there. So he is showing me that he is telling me that the standardization of case records is very well going there. It's very good there, so that the patients, whenever they go there, they give a number, registration number, so that they can enter in any hospital, in any government sector hospital, so that when they type the number in the computers, the case history, the whole case history of the patient gets open, and it will be helpful for the treatment of the patient.
Yes.
This has to be done, I think.
It is Ayushman Bharat Digital Mission. That is the name of the project. Every
Yes, sir.
person has got to registered patients as well as institutions as well as the physicians. They all together be registered on that portal, ABDM, Ayushman Bharat Digital Mission. And in fact, we have a session in Malayalam on that a couple of weeks back. If anybody would like to participate, or do you have any suggestions for the 1500 day of celebrations, you can give your own opinion. Because it is not easy to connect all these things. So Dr. Thanesh and Dr. Sahani sir, they are all the backbones of IFPH, doing all hard work to connect all these things. And our YouTube subscribers are gradually increasing. Now it will pass 5,000. In the coming days, it will go around 10,000, I hope. Another thing is that per year, 10 homeopathic medical colleges are added in India. Around 3 lakhs doctors are there. So manpower is there. what is needed, as the Dr. Gurugaran mentioned, the standardization is needed, but there's a problem because this is an art, not easy. You don't have some standardization of the musicians, it's not easy. Standardization of the artists is not easy, or the actors, it is not easy. So there's the individual compound is always there. So I think some new mechanisms to be adopted to have a standardization in homeopathy. Dr. Gurugaran.
Yes, sir, you are right, sir. It is difficult when we do the individualization of the patient.
Yeah.
But what I am suggesting is that whatever you do, you individualize the case and you individualize by treatment. Okay, fine. Please, when you come to the government, especially in government sectors, hospitals, when you open a case registration number, so that it should be available in any government sector hospitals. Whatever there is a treatment, previous history, all those things has to be added, so that the treating physician will come to know that what has given in before and what has to be given, what has to be done in the further of the cases by knowing the constitution and knowing the acute totality of the cases. I think this will be better, I think, because according to allopathy standardization, we can't make a protocol of it. The protocol will be difficult according to the patient. But we can do, I think, these kind of things. What do you say, sir?
Yes.
Sir, sorry to interrupt. Actually, in the chat box, there is one message.
Yes.
I'll just, fungal infection of penis in diabetes patient completes light yellow discharge with itching. Can it be treated this case with our medicine? Which medicine is best for same complaint? HbA1c was 11.6, now it is 6.5. With from diet control and exercise. Okay, it's Madam Jailalita Umesh. Madam, I think we can, with homeopathic treatment, we can to treat this kind of patient who has fungal infection. First, we need to take the case properly, and we should advise him to have hygienic measures properly. And the medicine, I think, of Hepar self will work for this, but we need to take the case fully. Individual medicine, like individual case has to be taken, and based on the repetization only, we can give the medicine. But I think Hepar self will help in this case.
Okay. And Dr. Thanesh is there. Dr. Thanesh, what about our 1 week program? It's a cut and rise of the 1500 day of celebrations.
Yes, we have planned 9 days, 7 days celebration with a discussion on homeopathic treatment on human and animals as well as vegetables kingdom. With that's a very good subject to be discussed. There will be discussion for 7 days from international participants.
Yes. What about the resource persons? Yes.
We are getting resource persons from international level. Senior doctors from international level are participating. Doctors from USA, Bolivia, Argentina, Chile, UK, Pakistan, Bangladesh, and Indian doctors are also there. Of course, some doctors from Turkey may be there.
So everything is ready for the 1 week celebration of the 1500 day, isn't it?
On the 3rd itself, we have participants from Bolivia, Chile, and Argentina. 3 persons on every day will be discussing about the same subject.
So what about getting a Guinness record, acceptance of the IFPH? Any move on that?
Because since we have not uploaded all the sessions in our website, there is no chance for getting such a certificate, unless it should have been there in the website on the very first day itself. So there was some problem with that.
Yes, I think even though we are not at all taking all these from the initial points, there still deserves that, I think.
And definitely, we can apply in some other from some other sources. Sometimes we may get some kind of certificates for that.
I think from the day 200 or 300 is there in the domain.
Yes, yes.
Yes. Okay. So all those who are participating in this session will try to get such a appreciation from the Guinness Book to IFPH. There will be a great boon to homeopathy that will further enhance the effort of Dr. Dhanesh as well as our Sahani sir.
Not only myself, Dr. Manoj is also doing a lot of work for us. So even though today he is having severe fever, he took charge of the session. You can see his face very tired, but still that's the responsibility of being a homeopathic doctor. That's why he is coming out with sincerity to homeopathy.
We are also arranging some session Malayalam also in the local language. There also we have discussions on this challenges in the education sector faced by homeopathy and what are solutions, connecting 6 or 7 principles in our colleges. Then another one is this the science of homeopathy by a scientist. Then the disaster management chairperson, natural calamities and the health problems. In such a way, we are arranging vivid type of sessions in Malayalam also. I think it's time to wind up the session. May I invite Dr. Gurukiran? He was there with the discussions and very active to express vote of thanks to Dr. Shalini.
Yes, sir. It's my privilege to do this honor. Thank you, sir. Thank you, IFPH. And Dr. Shalini, I have listening to your cases. It was good going. And I need to mention those things what I have mentioned earlier, that the potential of homeopathy is more broader. You can reverse those cases and keep up the cases, doing it properly by giving the right constitutional medicines at right point of time. And also you can make use of sarcodes and nosodes, so that if there is any paucity or if there is any problem in the progress of the disease or the progress of the case, you can make use out of it. And it was a wonderful session. It was well presented case of 2 diabetes mellitus cases. So I think the platform has given you a chance to portray these kind of cases, and the participants have benefited from these cases. So they will get approaches what we can do in the diabetes cases. Thank you. Thank you for this platform.
Yes.
Thank you, sir. Thank you.
Okay. The reversibility or irreversibility is the word or the version given by the allopathic people. So with homeopathy, we should have our own vision and our own mission. With that remark, let me conclude today's English edition. Hope you then will back again tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program in Malayalam. Thank you.